and welcome back to Chai Chat with Lavina, where we're discussing the workforce crisis and navigating the process to get appointments for GP as well as the operations and other secondary care. Thank you very much for your time. I am here with Dr. Chaand Nagpaul and with Dr. Parag Sighal. So he's in secondary care, you're in primary care, which means he's a GP and he's an endocrinologist. So for, you said, Asians or Indian subcontinent people who are getting delayed appointments, how can they navigate the system to get earlier appointments? ये मेरे साथ भी होता था actually पहले. मुझे समझ नहीं आता कि बात कैसे करनी है ताकि we though I know the language and always have, to just kind of break through. वो break through नहीं हो पाता है. What is it?
Look, it's very difficult for any of us. So for me as a GP, if I ring up my local hospital, there's a switchboard. The person on the switchboard needs to understand what I'm saying, where I want to be directed to. Then when they transfer you, the person you want to speak to is often not there. So for a patient who is, say, waiting for a knee operation, and they haven't heard because they're one of the 7 million people waiting for treatment, when they ring their hospital to find out where they are in the queue, it's very difficult because to get through to the right person. And what I'm finding as a GP is that the people who are able to make more of a fuss, who will want to challenge why they're waiting and know how to complain, are the ones who are therefore then getting their treatment perhaps expedited. So our Asian community, our Indian community, by nature is a little more timid. They're not used to fighting for their rights. Plus, of course, the communication barrier, because when you're trying to contact a hospital, as a good example, it's not particularly culturally competent. The person you're speaking to may not understand your accent. You may not want to make a fuss. So what I think really needs to happen is that we need to have helplines which are culturally tailored, easily accessible for patients, because really if we're not treating people early and if we have groups of patients who are not being treated, it will actually cost the health service more, because they'll become iller as their treatment gets delayed.
So it's actually more pressure on the NHS. So,
absolutely.
And I always say this, हमारी ना हम लोग की right based, this is a rights based society. Ours is a responsibility based society. आपकी जिम्मेदारी उठाते रहो, आप आपने क्या किया, तो ऐसे में ना बोल नहीं पाता व्यक्ति कि नहीं ये मुझे ये चाहिए. And I totally get that point. So it's okay, just go for your rights. But for secondary care, Parag ji, आपके पास तो हम पहुंच भी नहीं सकते because we have to go through our GP. So how does that be manipulated or maneuvered?
Well, first of all, we have to think of the problem. The problem is lack of beds in the hospital. And I'll tell you what happens because of lack of beds. So there are more patients than hospital can cater for. Operations are cancelled. Clinics are cancelled because we consultants are asked to look after more inpatients. So this is a problem which is getting compounded day after day, and it's a double whammy. Why it is double whammy? The same patients who are cancelled now are seen in a private setting by initiative. So the government is paying twice, so it's double whammy. So we have to look at the problem or the solution. And the solution is, first, the foremost solution has to be more community beds to decongest, to free up space in the hospital. Unless we do that, even if we bring more workforce, it's not going to be beneficial because where is the workforce going to perform? There is no physical space left in the hospital.
But they still use Nightingale hospitals, uska kya hoga?
I don't know whether Nightingale hospitals exist anymore now.
So you made so much and then you destroyed it. I mean, what a waste.
When we had COVID and in the UK they built these Nightingale hospitals in record speed, in a month's time they built up these hospitals. The hospitals were empty because we didn't have enough doctors and nurses to staff them. So we have got a very serious problem that in fact we do need more doctors and nurses in our health service. And that's where I do think there is a real opportunity to collaborate with nations like India. Because there are too many barriers that are preventing doctors from other countries working in the UK. And remember, an important part about the National Health Service, the UK's health service, when it was born in 1948, it was built upon a foundation of doctors from other countries. It never was a true British workforce service. No, right from 48. And in fact, in the decades that followed, the National Health Service was developing upon thousands of doctors from India and Pakistan and some parts of Africa coming to the UK. And in fact, in the Houses of Parliament in 1961, there was a Lord's debate, that's 50 years ago, where the conclusion of the Lord's debate was that the National Health Service would collapse without the contribution of doctors from India and Pakistan.
Which is still true.
Which is, in fact, it
More
would collapse.
true.
And in fact, that's why we should not be putting obstacles. At the moment, there are visa issues. So, for example, we have large numbers of doctors from other countries. Look at typical doctors from India, for example, who have elderly relatives who need to be cared for. There are visa restrictions on getting those members of their family to come to this country, something that Parag and myself have been campaigning to change. Instead, what's happening is those doctors are then going back home, and then we don't have the doctors in the UK. So there are simple visa things.
So very
that make
simple.
a difference.
तो जब नाइटिंगेल हॉस्पिटल्स बनाए तो वर्कफोर्स नहीं थी. अब वर्कफोर्स एड्रेस कर रहे तो हॉस्पिटल्स नहीं है. My God, please break this maze. Please break this maze and tell me what the quick solutions on.
So I think as we discussed, the solutions are three top. If I have to summarize, three top. One is you need more community beds to free up, because there are so many medically optimized patients staying in the hospital, which I don't need to see, but I end up seeing them. They can be easily shifted out in the community setting or step-down facility. So, and unwell patients can be catered. So that's number one. We need more workforce. We have talked about the importance of more workforce, nurses, doctors, and other people. And the third thing is, there is a significant proportion which is coming to the hospital which can be dealt in the community, provided there is meaningful integration of primary and secondary care. And that is the way forward, having integrated service in the community, providing care closer to home. And the reason I'm saying that is because I'm not only secondary care, I've got foot in primary care because I'm doing sessions in primary care as a GP, as a specialist in primary care. So I can see the challenges in primary care also, and how integration will help.
Okay, so quickly now, while we end, solution 1, 2, number 1 for Asians or Indians to navigate the system, what are 1 or 2, whatever you want to say, and number 2 for the NHS, breaking this backlog and coming onto feet, possible not?
The first thing I would want to say to any patient, and especially from an ethnic minority, an Asian ethnic minority, is that if you are delayed in your care and you haven't heard from your hospital as to an operation date, don't suffer in silence. Please let the hospital know that you're waiting, and you're entitled to be given a response as to where you are in the queue. So don't just leave it to chance, otherwise you'll be waiting maybe a very long time. You should, make sure that you find out. You can also go and see your general practitioner if you're getting more ill, because it might be that your condition is worsening and you will need to be referred again more urgently. So don't just. The second is have the right advocacy. Because if you don't speak English as your first language, if you are hard of hearing, you might be an older patient, make sure you seek advocacy. And there is support available. If you don't have a relative, then there are community support available. So make sure that you get the right advocacy, because we have a very serious backlog. And I'm finding that people who are shouting the loudest are the ones who are getting noticed in terms of trying to be put on the queue to be treated. We need to make sure that all patients are equally able to and are in a fair queue to be treated, that we don't have some groups of patients who are further down the queue simply because they're not challenging.
Right. We'll come back to the NHS question, but answer to the same question for you. Solution, quick one.
Solution is,
because you are in secondary care.
Solution is we need more beds in the community. We need to decongest the hospital. We need more workforce, both in secondary and primary care.
Okay, brilliant. The NHS 7 million waiting list, DIY treatments, solution 1, 2.
We have to be honest. We have too few doctors in the UK, 43,000 fewer than the average European country. We have 1/4 of the hospital beds that Germany has, 1/3 of the hospital beds of France. That requires investment. We have a National Health Service funded by the government, and there's no two ways about it. The government has to now put up the resources so that the UK has an infrastructure that can deliver on the needs of its population. So yes, because we have a health service run by the government, it is a government responsibility to properly resource it and make sure we have the right numbers of healthcare workers, doctors, nurses and others, hospitals and beds, enough GPs, enough community facilities.
Brilliant, thank you. Demand increasing, supply less. It's a classic case. And always short of money and resources limited. Now that's another discussion if NHS is a white elephant, but solution for you for let's say our Prime Minister.
So we have to find different way of working. The current way of working, how the NHS is working right now, is not sustainable. And this is not just NHS. Every health system is under strain. US, despite 17% GDP spend on health services, struggling big time. So we have to find low-cost, innovative solutions. A different service delivery model, which doesn't compromise on the quality, but still delivers and actually reduces the cost of healthcare. We have to aim.
What is that?
So one model is integration of services in primary and secondary care, because if you shift patients from secondary to primary care, it reduces the cost. And that is why primary care is so important.
Secondary and primary, just for our vain minds, it's GP to specialist.
GP to specialist. If patients can be treated locally, can be treated at a lower cost.
So you mean that specialists specialists should come to the GP surgery weekly?
And there are successful models. There is a model of diabetes virtual clinic where a specialist goes, sits down and goes through 20 set of notes, sits down with GP practitioners, and actually it becomes a learning exercise and you address big
So instead
number.
of patients going to GP to hospital is coming to the GP service. Got it. Thank you ever so much, Dr. Nagpaul. Thank you ever so much, Dr. Singhal, for this brilliant advice, which I hope our Prime Minister Rishi Sunak would be listening to, because this is experience talking. And as far as our desis are concerned, make a hype about it. Go and make a little bit of ruckus, and that really helps sometimes. It's all about asking for your rights. And yes, be responsible, but also ask for your rights. And on that note, I want to hype a little bit about this Desi Hype, the restaurant where we are in Harrow, that has been a brilliant host to us, and we are going to gorge a little bit more, so you can be duly jealous. But you can though reach out to us on chaichat@arthak.com with your feedback, and Twitter me at Lavina Tandon, and find Chai Chat on Facebook as well. Thank you, take care, and God bless.